I'm 5 months pregnant, and my due date is September 9th, and I'll be having a boy.
In Illinois, 1 in 6 women is uninsured. Surprisingly, women in Chicago have higher uninsured rates than women in any other part of Illinois. Due to these rather high rates of uninsured women, in 2007, 600,000 women who needed to see a doctor could not do so because they lacked the money. Illinois has 6 major government-funded organizations that provide aid to low-income women. First is Illinois Healthy Women. IHW is a gratuitous program that offers certain types of tests such as mammograms and supplements such as folic acid at no cost to the patient. Then we have Family Case Management. FCM is an organization for low-income families that provides assistance in the search for familial doctors as well as with the providing of information on nutrition and parenting. Next we have Family Care. Family Care is an organization that provides full health care coverage to families with children under 18. The cost of family care depends on your monthly income, the number of people in your family, and in order to be eligible, you must be a U.S. citizen. Similarly, All Kids is a healthcare organization that provides children of low and working class families with health insurance. In order to obtain All Kids insurance, one must complete an application, and depending on one's yearly income, a monthly premium to pay will be established. Then, there is also Medicaid. Medicaid is a government-funded insurance program that provides low-income families with full coverage insurance at no cost. The application process for Medicaid is very thorough, and although the insurance itself is of no cost, during doctor visits, patients may have to make very minute co-payments. Lastly, there is Women, Infants, and Children. WIC is a program that is established to improve the nutrition of impoverished pregnant women and recent mothers. WIC provides special checks to purchase healthy foods such as milk and dry beans, as well as information on proper nutrition.
The mission of the Illinois Maternal and Child Health Coalition is to promote and improve the health of mothers, children, adolescents, and really families.
What is the Illinois Maternal and Child Health Coalition's goal?
So our goal is to really make sure that all women and children and families are able to fulfill their best potential. And our job is to really be the voice for the voiceless.
After receiving knowledge of the Illinois Maternal Health Coalition's goal, we proceeded to ask about the diversity of the clients in terms of social class, and she felt that the majority of the programs that they funded were aimed at lower income populations.
The majority of the coalition's programs are aimed at lower income populations, so I would say the majority are under 300% of the federal poverty level, which is about 66,000 for a family of 4.
Taking this into consideration, the coalition accrued large sums of money and created programs which were aimed at lower income populations and populations of color, the highest risk populations.
Chosen as an organization to put our resources and funding in those highest risk populations, so those populations that have poor health outcomes, so that we can try to improve their health outcomes and in turn kind of improve the average health outcomes for our state. So we have chosen to put some serious amounts of money in lower income populations and populations of color.
But how in fact does poverty affect health outcomes for pregnant women in these situations?
Poverty and low income status does have an effect on your access to health care, and then how you feel about that health care, in terms of your perception of the quality of health care that you receive. And we understand that prenatal care, for example, in lower income communities looks very different than prenatal care at Northwestern Memorial Hospital.
And what about the environment?
Being poor puts you in a population where you are at greater risk for many of these other things happening. So it's a combined effect of being poor puts you more likely in a high crime area, puts you more likely in a situation where you're not eating healthy, puts you more likely in a situation where you're stressed out and you have both food insecurity as well as housing insecurity. And all of those things combined kind of work together to reduce your health. We're on the right path, but we are not at the finish line yet.
In Chicago, there are more fortunate residents who have the means who are acquiring good health insurance, but of course for the price. I currently have Blue Cross Blue Shield of Illinois, HMO. HMO, basically you have to pick a physician and you have to go to that physician for all of your care, and then let's say you need a special exam for anything else, you need to get a referral. For example, I need an ultrasound, I need to get a referral for my ultrasound. If I need a special exam for the baby, I need to get a referral. And that it covers it all. Because if I had PPO, which is the other insurance where you can bounce around from different doctors, you have to pay more. And with HMO, I just pay a set deductible, which is $25, and that's it. So for my whole pregnancy, I'm going to pay $25 and I'm covered. It's nice to know that I have health insurance in case anything happens to me or any of my family. I work and I make a nice living. I can't complain. But I don't have to worry about anything. I have a nice job with health insurance benefits. The insurance takes care of everything. I paid one copay and I feel safe and secure that everything's going to get covered. Recent proposed budget cuts, both on the federal level and on the state level, have threatened organizations that help mothers who don't have the money or opportunities or resources, like Nancy Castro.
What goes on at Springfield and what goes on in Washington, D.C., and how the passage of certain legislations and the situation with our budget, for example, how that affects people at the community level. And that things are passed every day. Not all of them we know about, but there's this trickle-down effect, and that policies can affect health. So our goal is to really make sure that all women and children and families are able to fulfill their best potential. And our job is to really be the voice for the voiceless. So for those communities that don't know that, there's budget cuts and we might lose $50 million in the federal budget for maternal and child health programs, my job is to fight for them.